And we are live. Happy Friday. It's Dr. J here in the house with another live nutrition and functional medicine Q&A. What is going on? Feel free and chime in with any of your questions, comments, or concerns. Love to get clinical, love to get applicable, so everyone walks away with great, actionable info. Awesome. Great. So what's going on in the world of nutrition this week? You guys tell me. I can share some clinical stories this week. A couple patients with chronic pain issues and chronic digestive issues. Simple food changes can make a big difference. Sometimes they do, sometimes they don't. Imagine you have a patient that has maybe 6 or 7 key issues that need to be addressed. Obviously, if food's a big one, but not all the 6 or 7 include the food, then they may get 10, 20% better. Some patients, while addressing a food issue, that could be a core issue. It could be 50 or 80% better. So it's really interesting working with patients. Some patients, a food item can make a huge difference. Some patients, it can make a smaller difference, but an important difference. And it's hard to know who does the best. That's why we kind of have our general checklist when we deal with any type of a sick patient or patient that has chronic health issues. We check everything off and go through one by one to ensure we do not miss a thing. Delty writes, and does oil pulling work? I mean, the whole idea of oil pulling is toxins are fat soluble, and you use something like a coconut oil, like a pulling oil, and that's going to help pull and kind of take any toxins out of the gums, out of the mouth area. You would just kind of swish your coconut oil around for like 10, 15 minutes and then spit it out. There's also a new toothpaste that I've been using the last couple of weeks that's been pretty good. It's called Revitin, and it's a toothpaste that has some really good nutrients in it, specific fulvic minerals, and has CoQ10 in there, a bunch of healing prebiotics for the mouth and the mouth flora. And that's really good because I rub it really around my gums because CoQ10 is really important for gum health overall. Low Heat writes in, Dr. J, oregano oil internally for tinnitus. Well, I mean, it depends what the root cause of the tinnitus is. Tinnitus is ear ringing. Now, 25% can be autoimmune based. I see a significant correlation with Hashimoto's and tinnitus. So you want to make sure your thyroid's looked. And of course, when you're dealing with potential increase for autoimmunity, you want to look at the food. You want to look at the gut. So gluten sensitivity, grains, autoimmune paleo. You want to look at gut infections, digestive function. These are going to be really important things you want to look at. JPat family writes in, I'm on a cycle balance on day 16 through 29 of my cycle and Feminescence Pro. Are you sure you're on day 16? I typically prescribe cycle balance on day either 14 to 15. 16 sounds a little bit late. My cycle was long before starting. Now it's too short, 18 to 24 days long. Should I just keep the protocol as usual? Yeah, keep taking it because, when you bleed, let's say you bleed on day 26, well, it's no longer day 26. It's day 1, right? So the whole goal is you're using the progesterone to help, one, improve your progesterone output in the luteal phase. And ideally, you're going to be able to continue to lengthen it over time. And then by using some of the adaptogens, you're going to help with the upstream HPAG, G-axis, hypothalamus, pituitary, adrenal, thyroid, gonadal, and gut axis. So hopefully that will start to get better over time. And again, if we're in the middle of doing any killing, that can always be a setback hormonally. But make sure you're taking progesterone at the correct time of your cycle, typically 14 to 28 or 15 to 27, in that range, 13 to 14 days typically. Check your protocol sheet. And if you go short, don't worry about it. Keep trying to stretch it out. It takes about 6 to 12 months to reset someone's cycle. And if there's any additional stress going on, poor diet or even kind of gut killing or gut clearing, that can always set you up. What new interesting studies have you read recently? That's a great question. I really haven't been going. I mean, I typically look at other people that spend more time in the research, and I try to read summaries and get information that way because I'm just too busy clinically with patients. I would just say big things that have clinically, I've seen clinically. I have to think about that. I'll come back to that question. JPat, my normal cycle is about 32 days. Yeah, so I would typically do. Now, is it always 32? Is that just kind of how long it's been typically? Because usually the average cycle is about 26 to 30 days. So I would probably do, cycle balance support more than likely day 15 to 29 with you, and probably bring your cycle back to a more 30-day type of range. That's what I would look at. Couple things, you can look at regarding, and the research is regarding intermittent fasting and or ketogenic diets. Lots of good stuff coming out there on the fasting side. Telomere length improvement, cellular autophagy, improving stem cells. These are all really important benefits. Some people say you got to fast. Some say you can get the same benefit with a ketogenic diet. I also like intermittent fasting because you're fasting, but you're still getting enough nutrition in your daily window. So if you're under stress, you're still going to get B vitamins and minerals and essential fats and good quality amino acids in, but you're just really optimizing that window by having an 18 to 16 hour fasting window, maybe a 6 to 8 hour eating window, which can be really helpful. What can I do for severe plantar fasciitis pain aside from regular stretching? Well, stretching typically won't help plantar fasciitis. I mean, a lot of that's going to happen because of adhesions in the plantar fascia under the foot. And a lot of that can also happen from tight muscles within the gastrocnemius, so the middle part of the calf muscle. So you need to find a really good myofascial release therapist that can work out the calf. And then also you can do like a tennis ball and roll under your feet for 1 to 2 minutes, especially in the morning. If you have plantar fasciitis, usually in the morning, it's like really stiff. So you improve the pliability in the morning, take that beef jerky, make it into a nice soft tenderloin, and then you can progress up to a golf ball, or not a golf ball, but a lacrosse ball after that. But seeing a good therapist too on the myofascial side, work out the calf, work out the plantar fascia, and you may have to look at the hip as well. You always got to go up the chain when it comes to structural medicine if you want to get to the root cause. You're welcome, J. Pat. Low Heat writes in, thanks, doctor. I have AS, so imagine that's ankylosing spondylitis, which is an autoimmune condition affecting the spine, and recently began having grayish substance generation every day in the throat and ear ringing too. TSH is fine on the blood test. We'll put effort on the gut. Yeah, you definitely need to look at the gut. That sounds like potential grayish, kind of whitish substance. That sounds like kind of a thrushy kind of fungal issue going on. Low Heat writes in, doing keto, vegan diet, any more advice? Well, I would just say, why are you doing vegan? Why are you avoiding animal products? And if you're avoiding animal products, I would always try to negotiate what would you be open to adding in? Would you be open to doing bone broth? Would you be open to doing some mussels or some oysters? Would you open to be doing some egg yolks or some lighter white fish? If we could add any of those good high quality animal products, and that would give you a whole bunch of extra nutrition. And you'll probably have to rely on really good fats like coconut oil, palm oil, avocado oil, olive oil. Those would be your probably best fats. And again, your cooking fats out of the two would probably be coconut would be the more stable saturated fat. Anthony A441 took magnesium and caused dehydration, insomnia, can throw other minerals off. Well, I mean, it depends. I mean, off the bat, you should be using a good kind of full spectrum essential mineral, kind of a Celtic or a Himalayan or a real salt. And you can do a half a teaspoon twice a day in your water. And then you can salt your food liberally throughout the day. You can also run your foods through chronometer to ensure that you're getting enough potassium, which is about 4,700 milligrams, magnesium, anywhere between 500 to a gram a day, your calcium close to the same, your sodium and or your sodium chloride from healthy minerals as well. So take a look at that and see where you're at mineral wise, but make sure you're getting minerals in your water and you're salting your food as well. Paul writes in, is doing your detox protocol for 90 days instead of 60 just as effective? Well, if you're doing it for 90, that's longer. So that's going to be good. I mean, the whole idea of taking 4 pills instead of 6. Oh, I see what you're saying. I mean, I would just try to get you to go to 6 so it's more therapeutic. I mean, yeah, it would still be beneficial. I mean, the whole goal of a detox like that is, number one, you already have hydration, you already have like organic and food quality down. We're just adding in extra amino acids, extra B vitamins, extra antioxidants, extra liver tonifying herbs to help support the liver. So one, is tonified and supported, but also that it will dump more toxins out too. Birdie, you're totally welcome. Rakesh writes in, hey, Dr. J, thank you for your videos and your medications. DHEA drops and pregnenolone have helped me with mood and stabilize my sleeping issues. That's excellent. Very good to hear. Has bronchitis at night to do anything with the GI Clear 1, 2, and 5? So are you saying that since taking the GI Clear 1, 2, and 5, the bronchitis has gotten worse? Is that what you're saying? If so, you should be doing the ginger tea because that's going to have some really good natural anti-inflammatory support to help with the throat area. You can also get some peppermint essential oils if it's in your bronchi and your lungs, and you can just take a couple of drops of, like, doTERRA has one called Breathe. Other lines like Young Living have it as well. Put it on your hands like this and take about 5 or 10 really deep inhalations, and that will help get some of that antimicrobial vapor into your bronchioles. That should help too. But I hate to say it, but if you need an antibiotic, now would be a good time to do it because you're on some of the clearing herbs. I just don't want it to get too worse. So just keep me posted on that. You're welcome, Lohit. Source Freezy writes in, Justin, 4 years ago, I did a colon hydrotherapy, totally destroyed my digestion metabolism. I have SIBO/parasites. What are your thoughts on FMT to get my colon bacteria? So I think you mean a fecal microbial transplant. I mean, number one, I would try to do all of the other natural things that don't involve putting fecal material up your rectum first. Number two, if you had to do that, I would just try to do that last. Try to do the other good functional medicine things. Go to the 6 R's. Do all that first to ensure there's nothing else that we're missing. Remove the bad foods, replace enzymes and acids, repair the adrenals and or hormones or gut lining, remove the infections, reinoculate, repopulate probiotics, retest. Roshan writes in, wanted your opinion on an insight I had on hypochlorhydria and burping. It's due to reduced chloride production in the stomach. Thus, the hydrogen doesn't form acid and is burped up. So SIBO test is deceptive. Well, I mean, off the bat, that could be. I think that's why it's really important that you put good quality sea salt and minerals in your water so you do have some of those good chlorides in your system. So make sure you add good salt to your water to help support that. See, Noor writes in, Justin, I'm about to move and need recommendations for a water filter, either on top or counter above. The one on your website seems to only get about around 80 to 90%. I thought maybe it wasn't updated. So yeah, go to justinhealth.com/water. The Aquasana has a pretty good one that works really well. 80 to 90% is really good. If you want the full, now if we're talking 80 to 90% like fluoride, then go with their reverse osmosis. That's a good one as well. Hope that helps. All right, very good. How to test or validate chloride production. I mean, I would use a CMP and just see how your CMP looks. That's your comprehensive metabolic profile. See where you're at for that. All right, that'll look at sodium chloride, potassium, magnesium. May not be potassium, but it'll definitely look at all the others. Roshan writes in, how to test. Rakesh writes in, this week it started. Okay, well, let's keep an eye on it. Ginger tea, peppermint oil. Do some of the herbs itself should help. I just wonder if it's probably a coincidence, I'd imagine. Paul writes in, is doing your H. pylori killing protocol for 90 days that is 60 days effective? Well, same question. I would definitely do it at that higher dose just to make sure we have enough potency to knock things out. Jose writes in, your opinion on phosphatidylserine. Phosphatidylserine I think is good. I would use phosphorylated serine, which is one step upstream. One enzymatic reaction upstream. It's very good. It helps sensitize the hypothalamus to cortisol. So when cortisol is higher, it can help bring down that cortisol. Very good at night. Very good to help establish cortisol rhythm, especially if cortisol is stimulating you at night. It can really help get your cycle, your cortisol rhythm cycle back on track. Jose, great question. Did the zinc tally test and it tastes like water. Okay, Anthony. So if that happened, then you know that you need a lot of zinc. So that's a good baseline for you. So zinc, if you don't need it, it's going to taste very metallic, almost like you're chewing on a battery, kind of like that. And it'll get worse progressively. So if you did the zinc tally test and it tastes like water, then, you know, go up to that 30, I think to 60 milligrams a day we talked about. You go too high in it, you can create a little bit of a copper issue. But I think if you have such a deficiency there, I wouldn't worry about the copper. You can just go to, I think, just type in, you know, paleo copper foods. You know, you're going to see some of the foods that are higher in that you're probably already taking. So I think that's good. Come back to that in a week or two and retest. Paul writes in, does your SIBO protocol get rid of SIBO for good, or can it come back? Well, that's tough. I mean, I see so many patients that have chronically been on lots of other protocols. The difference with mine is a lot of practitioners, they kind of have products that are more pixie dusted, or they just don't go high enough in the dosage, and or there's other lingering infections that are still in the gut that are making its way out. And sometimes it can take 2 or 3 times. But the goal is that we retest. We don't guess, we test. Brandon writes in, oat shows arabinose, high oxalates, and high HVA. BMA low normal, serotonin low normal, not absorbing fats. Could candida be the cause? Yes, it sounds like candida could be the cause. I would definitely look at that, but I'd also want to look deeper and do an actual stool test, because you're just looking at urinary metabolites, which are good, but it's not going to be the be all or end all of the story. Augie X1 writes in, would you recommend someone to take collagen protein if they're diagnosed with scleroderma? I think you asked me this question last week, Augie, or someone else did. So it depends. I mean, I would work on getting all of the diet 100% dialed in first. If I see markers that show me a lot of malabsorption, let's say we see a lot of stool issues, a lot of food particles, a lot of achlorhydria or low stomach acid or enzymes, poor digestion, fingernails, hair, all these things off, I mean, I would definitely go and use some free form amino acids to start, work on the diet, work on the digestion first. I'd probably work on all that stuff for the first month or so before I would bring that in, but I'd work on cooling the inflammation off first, Augie. Rashawn writes in, outside of diet, physiology, is there anything you can think of which can affect chloride production in the stomach? I would say just making sure you get enough of the good quality chlorides, and I would utilize hydrochloric acid as well to supplement in the meantime. Source Feezy writes in, Justin, would you recommend for fish oil for a 12-year-old girl? What's the best product? I would recommend my Omega Supreme. It's a triglyceride blend, and it also has lipase in it. Triglycerides better absorbed, and the lipase in it helps ensure that you're going to digest it better. So Omega Supreme, 1 to 2 grams would probably be fine for a 12-year-old girl. It depends. 1 gram if there's no major inflammation issues. If there's more inflammation from whatever reason, then we can go up to 2 grams. That's totally fine. Danielle writes in, any suggestions on insomnia, not drinking alcohol or eating carbs, not pregnant? I'd work on blood sugar stability, healthy proteins and fats at every meal. And from there, making sure you're not going longer than 5 hours without eating. And if doing a little bit of carbs at night helps, fine, like a little starch. If not, we can always go to GABA. I got a little GABA action here that I would take it when I get stressed. My patients stress me out. I take some. So GABA, magnesium's going to be great. You can always make sure your bedtime routine was dialed in, blue light sunglasses. You can do some of the Somnifit mouth tape to help with breathing through the nose. You can always do a little bit of GABA, L-theanine, magnesium is great. We can always go to some of the more relaxing herbs, valerian, lemon balm, chamomile, kind of a sleepy tea kind of thing. And we can always go to amino acids, 5-HTP, 100 to 300 milligrams. 1 to 2 hours to right before bed with the B6. We can always throw in, if we need a little bit of sublingual melatonin, couple hundred micrograms to 1 milligram to start. See how that works. There could be other things going on too, but look at the sleep hygiene first. That's the low hanging fruit. Look at your diet, and then we can go to some of the supplementation to help support that. Why is Giardia hard to kill? Oh, it's a tough little critter, right? Thing's been around for probably hundreds of thousands, if not millions of years. It's pretty damn adaptive. Again, I think a lot of people have problems killing infections because they don't actually make diet changes, lifestyle changes, deal with their hormones. They just go after it, and they don't really have a stronger immune system to support the killing. Would DE be good for killing Giardia? Yeah, I think it'd be a good support. DE stands for diatomaceous earth for everyone at home. Paula Hearn writes in, what can be done for arthritis for the hips? Doc wants to do surgery because of 40-year-old and too risky. I would not do surgery. I would figure out what the root cause is. If it's bilateral, is it a wear and tear issue? If it's a wear and tear issue, what were you doing? Get your muscles turned on so they're absorbing force better. Get amino acids, get collagen peptides in there, get soft tissue work, get anti-inflammatory nutrients in there. Chondroitin sulfate, collagen peptides, systemic-based enzymes to clear out inflammation, liposomal curcumin, good myofascial release, good chiropractic work. Get the root cause of it addressed. Brandon D writes in, one more thing, my CRP test was normal, less than 1. What would be the best test for inflammation? Well, that's a good test for inflammation systemically. We could always throw homocysteine in there. We could always throw a gut inflammation test called calprotectin. Those are some good tests. ESR, erythrocyte sedimentation rate's good. Danielle, you are welcome. See, I'm going to check Facebook here. I'll give you guys a little Facebook love. Okay. All right. Julia writes in, CBD oil for arthritis. It has worked wonders for my dog's arthritis and hip dysplasia. I do agree. I think I like CBD oil, partly because I can rub it right on the area. I love it. There's one I've been using now that works great that has frankincense with it. And I like that because you can target that area. Very good. Add that to the list, Brandon, or who was that? Paul, for the hip inflammation. Thanks, Julia, for adding that. Petros writes in, low stomach acid and zinc deficiency, how to deal with both since stomach acid needs zinc and vice versa. So you need to start on a paleo template minimum. need to dial in enzymes and acids minimum. You need to make lifestyle changes to decrease stress while you eat so you can break down that food. That's a starting point. And now you may have to dig deeper to look at the gut to see if there's any other lingering deeper infections. Rakesh writes in, is Lectin Shield a good addition while on GI Clear 125? Well, I think Lectin Shield has a whole bunch of enzymes in it. So if you're on my enzyme synergy, you'd probably be okay. Jack JMC, what supplements did you take daily? Well, I mean, right now I got a handful on my desk. I have mitochondrial support right here. I have ashwagandha as well. I have GABA if I get stressed. And then I've been adding in, hold on. My son was getting a little bit immune compromised, so I have a medicinal mushroom blend here with reishi and maitake. And I've been doing those kind of side by side. So I typically take maybe between 5 to 8 things a day. It just depends. If I'm stressed, I'll be hammering that GABA and more adaptogens. And then sometimes on the weekend, if it's like a non-stressful day, I'll just take supplements maybe once a day and keep it really, really simple. It just depends on where I'm at and stress. The more stress, then the more I'm on top of it, right? The more I'm relaxed, then maybe just once a day, maybe my multi-pack in the morning and night, and then maybe one herbal mitochondrial support during the day. Great question, though. Source Freezy writes in, Justin, one more thing. Ever since I started getting an autoimmune symptoms, I see flashing lights when I look to the left and to the right. Is that my immune system attacking my retinal tissue? Hard to say. I mean, when you start getting healthier and you start getting more aware and studying this kind of stuff, you become like a little hawk at noticing every little thing. Just keep an eye on it. And just give yourself more time in getting the inflammation down and getting deeper at gut and or hormone issues that could be a problem. Favorite supplement for memory? That's a good question. I mean, of course, anything that's mitochondrial based will help the memory. I love amino acids, 5-HTP, serotonin, tyrosine. Those things are really good for memory. Those would be some of the good things. I mean, of course, you can do things like ginkgo to improve blood flow, resveratrol, curcumin, which can help with inflammation in the brain. Inflammation in the brain can cause brain fogginess. So if you decrease inflammation in the brain, then you'll be better cognitive-wise. So that can be helpful too. I came down with Bell's palsy, half-face paralysis a week ago. Any ideas for me to look into? So, I mean, Bell's palsy, a common cause of it, if I remember my physiology, is varicella zoster, not varicella, herpes zoster, so shingles. Shingles could be a potential viral issue. And what happens is this trigeminal foramen here comes out, and that foramen can get inflamed and can pinch down on the nerve, and you can see it on your face. I think you said half face. Yeah. So that supports the foramen. If it's an upper motor neuron lesion, it affects the cortex. You'll see the whole face on the other side. If it's a foramen issue, you'll see it on that face, half face, unilateral. So it's probably, I would be on antiviral support. I would be on silver. I would be on reishi mushroom. I'd probably be on some cat's claw to help reduce that. I'd also be on some curcumin to drop the inflammation and make sure your diet's damn good. Hope that helps. Gabe writes in, uric acid, gout, are they related? Is it true you can get rid of it in a few days? Well, yeah, I mean, your gout is a condition where there's uric acid crystals deposited typically in the big toe, the thumb, or the earlobe. So cut down your fructose, cut down your richer meats in the meantime. I find it's not necessarily the meats, it's more the alcohol and the fructose that's going to drive it, but can make you more susceptible with the rich purine-rich meats. Jack JMC, do you think colon cleanses should be done monthly? I mean, it depends, right? I mean, if you're going to do like a colon cleanse or like an enema, I mean, do a coffee enema, right? The best part of waking up is Folgers in your butt. At least with that, the coffee makes its way up to your gallbladder and liver and dumps a bunch of toxins and increases glutathione. So if you're going to do it, do a coffee enema. I personally have never done one because I've always been regular. So I just haven't needed it. I mean, Dr. Group's got an oxy powder cleanse, so you can do it with the supplementation as well. So I personally don't do it, but if you want to detox more, a good coffee enema may be better. What are your most stressful patients? It depends. Patients that have been sicker longer and patients that have kind of been run through the mill of lots of other doctors because they've done so many things and they've done them all at different times. And sometimes in functional medicine, it just takes a while and we have to do things in the right order. So if someone's done this with someone else and that with someone else and that with someone else, and I want them to do all this together, they're kind of like, well, I don't get it. I've done it all. It's like, well, yeah, we got to do it in the right sequence, right? You don't go to a, if you have a 6-number combination for a safe, you don't say, well, I've used those numbers just all at different times. The combination has to be done at the same time. And sometimes it also just takes time and going through our logical, hey, plan A, plan B, plan C, and working through that progression. My easiest patience is you just do plan A and plan A works, and that's great. But sometimes you have to keep on going down that list, and that can be tough because the patients have to continue to be compliant during the process. Bob, you're totally welcome. Kendra writes in, what would cause my HDL to drop from 79 to 17 in a year? I'm 43. My total cholesterol is suddenly high risk with no previous issues. Thyroid hormones on the low side, but still with a normal range. So your HDL went from 79 to 17? That's really a big drop. I want to know what your liver enzymes look like. I want to know what your full thyroid hormone panel looks like, because just saying it's on the low side, it could be way low and you're just, underestimating it. So I would need more data, but something's definitely a little off. Before I freaked out, I would just make sure my diet's good and I'd retest in a couple of weeks. Can't too much protein powder cause uric acid? Well, it's possible. The purines are going to be the bigger ones. It's going to be the more richer proteins that will do it. But you look at Dr. Johnson's research out of University of Colorado. His issue is the higher fructose. The fructose then goes and gets converted into uric acid. It also decreases endothelial synthase, which decreases nitric acid, which can then constrict your vessels. So uric acid can also be a big cause of high blood pressure because it decreases that enzyme endothelial synthase, which is important for vasodilation. So the first thing is get your fructose levels below 15 grams daily. And then I would just go in the meantime, just to leaner meats, probably maybe a palm's worth of protein per meal in the meantime while you're getting things fixed. They got the cactacine, or there's allopurinol as well. There's a couple of medications for basically they're xanthanox. Yeah, they're like it's a mechanism there that blocks that uric acid. I forget the actual enzyme step. Okay. One more thing, along with keto vegan diet, I can add collagen peptides. Yes. Eggs and bone broth. Yes. Beats tinnitus if I add oil of oregano. What should the dosage be? How long? In my line, we typically would do the GI Clear 5, which is my emulsified oil of oregano enterically coated for, I think that's 75 milligram capsules, but it's very potent. And now do that for 60 days. You are welcome, Lohit. Kendra, you're welcome. Excellent. Paul writes in, is a torn labrum all the way around plus arthritis and bursa? So, off the bat, I would look at using some type of electrical therapy. My friend Garrett Salpeter over at NewFit, he's down in Austin, Texas as well, has great therapy to help with that. He makes sure the muscles are turned on and will use electricity to help. And you may also want to look at making sure the nutrition's dialed in. I would also look at getting some stem cell injections as well. I would go the stem cell route before you did anything else. Google Joe Rogan, Mel Gibson podcast on stem cells. Check that out. Genesis writes in, what are your thoughts on proper non-toxic material, low EMF infrared saunas? I don't know. Right now I'm going to be buying a sauna really soon, and I'll be buying Dr. Klinghart's recommended sauna, which is Sunlight, and which I know does pretty well. Near or far infrared sauna better? I've heard far infrared sauna is better. I'm just going to be getting a mix of it. Evan, my colleague, buddy, you guys all know, has some infrared sauna lights on his desk that he does during the day as well. All right, cool. All right, guys, any other questions for me? Feel free and let me know before I check out for the weekend. I'm checking Facebook here. Don't want to ignore y'all. I got my Facebook on my iPhone, so it's just, it's a lot smaller of a screen than my 30-inch big monitors here. All right, y'all, good chatting with you. You guys have, hold on, last question. Just finished. Ooh, okay, 2 more questions came in. Sheila wrote, just finished Candida protocol, still having sinus symptoms. Will they go away eventually with receding? Well, so off the bat, I would probably go and purchase a Nasoline, and I would get some of the Xlear or Xylear neti solution. I would do that flush once to twice a day. You can always put a couple of drops of iodine in there as well to make sure that nose is flushed out really well. And then you can also play around with doing some colloidal silver drops. Do 10 drops 3 to 4 times a day in each nostril. That should help. Now get to the root cause. Make sure your air filter is really good. Christina writes in, hey, Christina, what are your thoughts on CBD oil for sleep and managing anxiety? Just wanted to hear your general thoughts. I think CBD oil can be really good for anxiety and for sleep. Now, the question is it the root cause? I think it's very palliative. First off, I would make sure we support the hormones adrenally. We want to support the female hormones, potentially with progesterone, potentially with some upstream modulating herbs like maca and or chase tree and other herbs. So I'd want to make sure the hormones are hit on more directly. And then from an ancillary perspective, we could potentially throw in some CBD oil, but there's other things that I would throw in there to deal with the anxiety first. I would be using adaptogens like ashwagandha. I'd be making sure we have extra magnesium and extra GABA on board to help. Hope that helps there. But yeah, you want to make sure the sleep is 100% dialed in there, Christina. All right. And then let's see here. A couple other questions just came in. Yeah, I'd like to be on Joe Rogan's podcast. Many of you guys know him, have him reach out. I would love to chat with him for a couple hours. You are totally welcome. Claudia writes in, hey, Doc, what are the best supplements for skin after 45? Resveratrol, pine bark, hyaluronic acid, xanthan. Well, I think number one, make sure your gut's doing well. Make sure your gut's doing well. Make sure you have good amino acids, good collagen peptides, I think are great. There are lots of good, interesting things out there. I would look at Marie Veronique's line. She's a really interesting anti-aging oil that I think works very good. It's got some really good antioxidants in there. It's got some emu oil. I like that one as a good essential fatty acid product. But outside of that, make sure internally you're eating really good. Your digestion's good. Make sure you're not getting too much sun, right? And then there's some interesting potential stem cell therapies that could be really beneficial in the future, because stem cells, I think, will be the way of the future. There's some interesting videos out there with burn victims. They use these stem cell guns to inject stem cells into the skin, and like skin heals in like a few days. It's like insane. I think that will be the future. People will basically be like walking around at age 70 or 80 with brand new skin. So that I think will be what we have to look forward to in the next 20 years. Genesis writes in, Klinghardt and Hyman like Sunlighten, but Cresser and Mercola like different brands. It's hard for us to know. Yeah, I mean, I think you just got to look at it and make your best guess. I think either way, it's kind of like, okay, someone likes the BMW, someone likes a Mercedes, someone likes a Cadillac. They're all great cars, right? So I think just kind of look at it, maybe call the, your local rep, and then just make your best decision based on gut instinct. For me, I know they're both good brands. The next is going to be what works for me, what is more aesthetically pleasing, what's more functional for me and for my needs. So I would make your decision off of that. Petros writes in, thank you. Have a nice weekend. You're totally welcome. Thank you so much, Petros. And Genesis writes in, should you remove heavy metals or gut infection first? Definitely gut infection. Heavy metals a lot of times get removed via the hepatobiliary system. And if we don't have good gut function, we could reabsorb them. You are welcome, Christina. You're welcome, Susie. Daughter has Crohn's, calprotectin levels at 5, 8, 8, 9. That's the highest calprotectin I've ever seen. So we really want to get diet change, digestion change. We may have to totally put this person on an elemental diet as well, just to get that inflammation down. But Susie, feel free and have you or your daughter reach out. They're going to need a lot more help. That's some serious calprotectin. All right, y'all. Hope you have a phenomenal Friday. I will, and enjoy the rest of your day. Take care. Give me a like, give me a thumbs up, give me a share, crush it. Get my view count up. That means I get to help more people like y'all. I really appreciate it. Take care.